4 Special Report.
And thank you for joining us for this special report. Right now, we're going to take you live to the Metro Nashville Coronavirus Task Force. They're holding a daily briefing right now. They're going to give us an update on how the city is dealing with this pandemic. Let's listen in live.
And Jessica Fain, Chief Strategy Officer at YMCA of Middle Tennessee. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are here with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. Now on Monday, May 25th, Nashville itself can have a bit of a graduation and move on to phase 2 of the roadmap for reopening Nashville. All public health metrics tied to the roadmap indicate that Nashville is ready to carefully begin phase 2. Restaurants and bars serving food, retail stores, and other commercial businesses can open to 75% of capacity. Live music, a hallmark of Nashville establishments, can return to local restaurants and bars in a similarly phased format, but with restrictions to gatherings of no more than 25 people. Additionally, personal appearance businesses, including hair and nail salons, day camps, amusement and attraction venues, and museums can open at 50% capacity. Dr. Alex Shahanger will provide more details on phase 2 momentarily, including the public health protocols that will help our local establishments keep workers and customers safe as they expand capacity or reopen to serve the public. Now, I want to take a moment to thank everyone for helping us reach this important milestone. Your efforts and sacrifices have saved lives and made it possible for Nashvillians to safely begin returning to work. Now, tomorrow, May 22nd, will mark just 30 days since the roadmap for reopening Nashville was first announced here in Davidson County, and we are able to reopen by meeting the metrics laid out in that plan. I'm grateful to local business owners for taking steps to protect their staff and customers, and I'm grateful to all residents for diligently practicing safe social distancing and wearing face coverings in public settings. We've made it this far because of the resiliency of our community, and that same grit and determination will safely carry us to the other side of this historic challenge. We will be a stronger city on the other side of this. Now, when we first began phase 1, Davidson County was still seeing a slight upward movement in our 14-day new case trend. The decision to reopen was not easy, but we closely examined all of the metrics related to our roadmap, consulted with public health experts, and decided we could safely begin to restart our local economy. Now, since phase 1 started, we have experienced a flat to downward new case trajectory over 14 days of test collection, and our testing capacity has grown significantly. Nashville's doubling rate has increased to approximately 1 month. Our contact tracing capacity has dramatically increased, and our hospital capacity remains satisfactory. Now, our metrics are encouraging, but we must maintain our vigilance. As always, our thoughts are with those who've tested positive for the coronavirus, and we have to extend our sympathies to the friends and families of the Davidson County residents who have died from complications related to COVID-19. As Dr. James Hildreth has said, the coronavirus is an invisible enemy, and it will be with us for a long time. We make the virus visible through increased testing and contact tracing. To safely live and work in the era of the coronavirus requires us to adopt smart health habits as part of our daily routines, including social distancing, wearing face coverings in public settings, and routinely washing our hands. These habits have helped us successfully advance through phase 1 of our roadmap and prepared us to safely begin phase 2. Now, since we first announced the roadmap, we've solicited your feedback through the Metro COVID-19 website. The comments and questions we've received from business owners, workers, and customers from across Davidson County have been very valuable in informing our reopening plan. You can view the updated roadmap and leave your feedback at any time by visiting covid19.nashville.gov. We're all in this together, and we need your help to find the right answers to create an economic restart without interruptions. Now, I want to welcome Dr. James Hildreth, President and the CEO of Meharry Medical Center. It's always a pleasure to learn from Dr. Hildreth's insightful commentary on the coronavirus and how we can best respond to the health crisis, both as individuals and as a community. And this morning, we're also joined by Jessica Fain, Chief Strategy Officer at YMCA of Middle Tennessee, who is here to discuss the importance of area daycare, particularly for the children of our essential workers, as well as YMCA's resources for parents who are caring for young children at home during this time. Metro Public Health and Metro Nashville Police Department continue patrolling area businesses to respond to any suspected violations of public health orders, which are protecting Nashvillians. Everyone has the right to be safe, and not just at home. I urge everyone to support businesses that are working so hard to protect both your health and the well-being of their staff. Look for employees wearing face coverings, reminders to maintain a safe distance from others, and readily available hand washing or hand sanitizing stations. All of us will need a little reminding from time to time. This weekend, Metro Public Health Department staff and Hands on Nashville volunteers will continue mass distribution at drive-through centers set up at 4 Metro Parks community centers. Masks will be available to pick up tomorrow and Saturday from 9 a.m. to 1 p.m. at Hartman Park Community Center, Bellevue Regional Center, Madison Community Center, and Smith Springs Community Center. Now, increases in drug overdoses have been observed nationwide since the onset of the COVID-19 pandemic. And unfortunately, Nashville has not been spared. This is an especially difficult time for anyone who's struggling from addiction, but help is available. Be sure to stay connected to your recovery groups and support networks if you are struggling with substance abuse. You can also call the Tennessee Red Line, a 24/7 addiction treatment and recovery hotline at 1-800-889-9789. And as always, please consider contributing to the COVID-19 Response Fund or visit Metro's COVID-19 website to learn how you can obtain direct financial, food, mental health, and social service assistance. And now I'll turn it over to Dr. Alex Shahanger, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus in Davidson County. We now have 4,530 confirmed cases. That is an increase of 26 cases in the past 24 hours. 1,368 cases are active, and 3,111 residents have recovered and have been cleared. We did have a death yesterday, a 90-year-old woman with underlying health conditions. We now have 51 Nashvillians who have died as a result of COVID-19. I, too, would like to express my sympathies to their families and friends. Here's where we stand as we enter phase 2 of our reopening plan. The 14-day rolling average of new cases is flat. The transmission rate is under 1. We have built a public health capacity to meet our goals, and our hospital capacity is stable in a satisfactory range. And we are confident the hospital capacity is sufficient should we experience a sudden spike in hospitalizations. We've said we will look at the data to make our decisions, and the metrics are all in the satisfactory range. In addition, the doubling rate of the virus is 29.6 days. This means it could take almost 30 days for the cases to double. This needed to be 14 days or fewer or greater for the virus to slow down in our community. So we are 2 times our goal. Furthermore, our mortality rate is 1.1% for Nashville. The state's mortality rate is 1.6%, and the nation's mortality rate is 5.9%. And 9.5% of Nashvillians who have tested positive. A positive test rate of around 10% shows that we are testing enough people in our community, and our positive rate has been around 10% since mid-April. In addition, more than 48,000 Nashvillians have been tested. Now, based on this data, it is the recommendation of the Coronavirus Task Force that Nashville moves on to phase 2 beginning Monday. Now, here's what phase 2 is going to look like. And you'll notice we have made some adjustments to the roadmap for phase 2 based on information we have gained on safe opening practices over the past weeks, as well as input from some leaders in our community. Now, some things will stay the same. Residents should stay at home if at all possible, work from home if you can, and people over 65 and those with underlying medical conditions should stay at home. Furthermore, residents should wear face coverings when they go out in public. Now, we are asking that no more than 25 people should gather at one time. This is an adjustment from our previous planning for phase 2, but we believe, and the science has shown us, that gatherings should be at 25 or fewer to better assist with social distancing and to minimize the spread of this disease. Now, for all businesses that will be open, employees interacting with customers must wear face coverings. Employers should screen their employees daily, and this includes a temperature check. Enhanced cleaning and sanitizing procedures must be in place. Now, restaurants, retail, and other businesses can operate at 75% capacity. Now, live music will be available in phase 2 at restaurants. This will be limited to two musicians who must comply with the social distancing rules as set by the state. Bar areas will still be closed, and dance floors will be closed as well. Bars that space out tables and serve food can operate as restaurants. However, there cannot be bar service or people standing in the bar area. Close contact personal businesses will be open at 50% capacity. This includes barbershops, hair salons, nail salons, spas providing body treatments, body art facilities or tattoo services, piercing services, tanning salons, and massage therapy. Appointments are encouraged, and customers should socially distance in waiting areas. Exercise facilities will be open at 50% capacity, or to the extent that is safe social distancing, or to distance in which safe social distancing can be maintained, whichever is less. This includes gyms, swimming pools, personal trainers, exercise classes, martial arts studios, dance studios, or climbing gyms. Community pools can also open at 50% capacity, and all deck areas must be at 50% capacity with social distancing practices in place. Day camps can open with some restrictions. Camp buses must be at or below 50% capacity. Cafeterias will be closed, and campers must bring snacks and lunch, or the camp may provide boxed lunches. Day camps will need to modify daily activities as well. Smaller venues and other minimal touch facilities can operate at 50% capacity. This includes bowling alleys, miniature golf, go-karts, movie theaters, water parks, zip lines, paintball, and other similar businesses. Facilities and areas with arcade games, ping pong tables, foosball, billiards, and other similar activities will remain closed for this time. All items that will be shared with other customers, such as bowling balls, golf clubs, and go-karts, must be sanitized between each use. Museums can also open at 50% capacity with social distancing. One-way traffic and other traffic controls are recommended so that patrons do not come face-to-face with each other. Exhibits should not be touched, and regular cleaning and sanitizing of all common surfaces must be done. Metro parks will reopen community centers, golf course clubhouses, museums, the sportsplex, and nature centers. These facilities will be at 50% capacity. Dog parks, basketball and tennis courts, playgrounds, sports and recreation leagues, skate parks, and splash pads will remain closed. Now, there's a lot of new information here, and so what I would recommend is please go to our website, covid19.nashville.gov, to find out more about phase 2. Furthermore, on this website, we will have recommendations around each area and clear guidance as to how better to proceed with each area. Now, we've done a great job, Nashville, at flattening the curve, and we are ready to move on to this next phase. But please continue to do your part. Stay at home as much as you can. Don't go outside if you feel sick. Get tested if you have any concern that you may have the virus. Wear a face covering in public. This shows your respect for your neighbors. Remember, the face covering protects others in case you have the virus but are not showing symptoms. Give everyone some space and take care of your families and friends. Now, one last thing before I finish. The community assessment centers and the assessment hotlines will be closed on Monday for Memorial Day. They are open, however, today and tomorrow, and typically 5 days a week, starting back on Tuesday. Thank you again for helping us flatten the curve and helping to keep your friends and families safe. Let us keep it up as we start phase 2, as we are all in this together. I now would like to introduce Dr. James Hildreth, President and CEO of Meharry Medical College. Thank you.
Good morning, Nashville. Today, I'd like to share some interesting and exciting research news and the prospect for vaccines. COVID-19 disease is caused by a virus called SARS-CoV-2. It is a member of the human coronavirus family. It was given that name because it's a close relative to the virus that caused the SARS outbreak in 2003. That virus's official name is SARS-CoV. So this virus being related to it is called SARS-CoV-2. The genes of these two viruses are very similar, and in some cases the genes are 90% identical. What that means is that for some of the proteins in these viruses, they're actually very, very similar. And that is true for a protein called the spike protein. And the spike protein has a very important job for the virus. It's the protein that allows the virus to bind to cells, to fuse to cells, and infect the cells. And that is why so many of the vaccine candidates that you hear about are designed to generate antibodies to the spike protein. That is why, because that protein is so critical to getting the virus into cells. In a paper that was published recently in a journal called Cell, which is one of the top biomedical research journals on the planet, actually, investigators at the University of Washington, the Pasteur Institute, and the Fred Hutchinson Research Center in Washington collaborated to identify the structure of spike proteins of SARS-CoV and SARS-CoV-2. They actually purified the proteins and made crystals of them, and then shot those protein crystals with X-rays, and by X-ray diffraction, essentially, they discovered the structure of these proteins at the atomic level. What they found was that just like the genes, the proteins are really, really similar, and in fact, in some parts of the proteins, they're identical. They hypothesized that if they immunized animals with the SARS-CoV spike protein, they might in fact cross-react or bind to the SARS-CoV-2 protein. And that's exactly what they found. They found that the antibodies not only bound to both viruses, they neutralized both viruses. And why is this exciting? This is exciting because it's possible to develop a vaccine that protects us against multiple coronaviruses. And that's important in the following context. As you remember, SARS-CoV-2 is an example of what we call a zoonotic infection, an infection that jumps from animals into humans. The natural host for coronaviruses are bats. You need to remember that there are 39 members of the coronavirus family. Many of these viruses are occupied or living in bats, and they jump into other humans and then jump into other animals and then into humans. My point is, there's every possibility that SARS-CoV-2 and COVID-19 is not the last coronavirus we're going to have to deal with. So having a vaccine that potentially protects against multiple coronaviruses would be an extraordinarily good thing. That's why I'm so excited about this result. The other thing to keep in mind is, because of what I just told you, there's an animal somewhere on the planet that still harbors the SARS-CoV-2 virus. So even if we as a global population put this virus behind us, there's every possibility that it will jump again from that animal into humans, and there'll be another global pandemic. That is why we might have to take the vaccine from now on in perpetuity, because the virus is not going anywhere. So that's really exciting news, and just an example of all the amazing science that's happening around the globe. We can all be excited about that. But as we move into phase 2 of the reopening, we got to remain vigilant. And I'll just remind you of the story of Albany, Georgia. Albany, Georgia is a town of 75,000 people, and at one point a few weeks ago, it had one of the highest per capita infection rates and death rates in the country. Why? 2 funerals. 2 funerals resulted in an explosive growth of the virus and deaths in that city. Just by 2 unknowing individuals attending a funeral, the result was this amazing outbreak in a small town in Georgia. So we got to remain vigilant, Nashville. We got to keep it up. And as we move into phase 2, remember, by protecting ourselves, we protect each other, and we won't become a vector. So let's keep it going, Nashville. We got this. With that, I'd like to turn it over to Jessica Fain from the YMCA of Middle Tennessee.
Thank you, Dr. Hildreth. Good morning. I'd like to thank Mayor Cooper for inviting our YMCA to take part in today's briefing, and thanks also to the other members of the task force, public health officials, community partners, and media who are working every day to keep our community safe and informed, and to the residents who are doing their part to weather some unprecedented circumstances. As Nashville continues to gradually and safely reopen, I want to speak specifically to 4 areas in which the YMCA is already playing or will soon play an active role in the city's efforts to balance the protection of public health and the reactivation of our economy. I'll speak first about the continued operation of childcare for essential workers, then talk more about our plans for the safe operation of summer day camps, our plans for reopening our wellness facilities, and the continued operation of our grab-and-go meal sites and virtual summer programming. For nearly 150 years, the YMCA in Nashville has been listening to and responding to our community's most pressing needs. In the wake of COVID-19, when we decided to close all of our wellness centers a few days before the official orders to do so were issued, we began thinking about how we might reposition our facilities to be of service in this unique crisis. We immediately thought of the child care challenges essential workers on the front lines would face as many daycares and other providers struggled to remain open under new distancing guidelines. Within a couple of weeks, we were able to open 7 of our facilities as emergency child care sites to provide care for the children of essential workers. Since then, through a partnership with the Tennessee Department of Human Services and the support of our nonprofits, donors, and funders, we've provided child care for nearly 300 children each week, all free of charge. Our experience with providing care in this environment, under new social distancing, cleaning, and health screening requirements, has prepared us for what we expect will be the next phase of caring for our kids, and that's summer camp. Davidson County is home to a 300-acre YMCA camp on Percy Priest Lake. That is, of course, Camp Widgiewagon. Our camp director there leads a national cohort of YMCA camps, and for the last few weeks, that group has been working directly with the CDC on guidelines for summer camps. This week, we've been in communication with Metro Health Department officials to review those CDC guidelines and to ensure that they would align with any local guidelines that might be issued. Much like the care we've been providing for the children of essential workers, when Camp Widgiewagon is permitted to reopen, we'll be taking a number of measures to guard against the spread of COVID-19, including twice daily temperature checks and screening questions for all staff and campers. Our campers will be divided into groups of 10 and will remain in that grouping with the same counselor during their entire session. Mask wearing will become part of camp culture. They will be worn during most all activities, except those during which it is impractical or unsafe to do so, like swimming, equestrian, sailing, or high adventure activities. And they will be required anytime the groups of 10 pass by or come into closer proximity to one another, and at all times on buses, and as groups transition to and from different activities. And our goal is to make masks fun, not just functional. Campers will be provided with masks when they arrive, but will engage in arts and crafts activities early on to make their own cloth masks for the use during the rest of their session. Hand washing and sanitation stations have been installed in all buildings, at all dining sites, and at all activity stations to allow for pre- and post-activity hand washing with hand sanitizer being provided during the activities. 60 10-person special bleachers are being installed to provide distancing for those groups of 10. Camp activities like skits, campfires, morning songs, etc., have all been redesigned and relocated to be conducted using social distancing. Our campers will be gloved for climbing and equestrian activities, and our health center at camp has been redesigned to segregate the I'm not feeling well campers from the cuts, bruises, bumps, and scrapes campers. Parent and vendor access to the facility will be restricted to limit outsiders' access to camp, and all check-in and check-out will be conducted in the car before children are allowed onto the campus. We will not conduct our weekly parent program or our parent shows. Our water bottle fill stations will be counselor controlled so that campers can't touch the spigots or risk cross-contamination. All meals will be prepackaged and per plate. There will be no buffet service for meals at camp. Our camper interactions with counselors and their activity leaders will be tracked to support contact tracing and communication should the need arise. And our parents will be asked to join in this effort by monitoring their child's health 2 weeks before camp and 2 weeks after camp. Now, there's no doubt this may be a summer like no other, but like everyone in our city, our state, our nation, and our world, we're all doing things we couldn't have imagined 60 days ago. And that means reimagining camp for our kids. It also means reimagining the way we operate our family wellness centers. On May 4th, 7 of our facilities outside of Davidson County reopened with limited capacity and services under the new business industry guidelines published by the Governor's Economic Recovery Group. In those facilities, this transition has gone well, and it has further prepared us for an anticipated reopening of Davidson County facilities when the time comes. We have shared the reopening protocols we used at our outlying counties with public health officials here in Davidson County, and we're encouraged to hear the news that gyms will be moving into phase 2 of the metro reopening plans. But let me be clear, even with this move to phase 2 for gyms, our focus is on reopening safely, not necessarily quickly. Even if Davidson County advances to phase 2 in the coming days, we will only reopen our Nashville YMCAs when we feel we have adequately trained all our staff and are prepared to operate in compliance with all local guidelines and recommendations. Fortunately, many of our staff from our 8 Davidson County Ys have had the opportunity to train alongside their peers in outlying counties, and they'll be fully prepared to reopen with new safety protocols, which include temperature checks and health screening questions for all members and staff each time they come to the Y, PPE for all staff with masks strongly encouraged for members, particularly when moving through common areas, self-scan-in, reduced capacity on our wellness floors and in our group exercise classes to ensure social distancing, ample access to EPA-approved cleaning materials for wiping down equipment, with additional staff placed to monitor social distancing and our enhanced cleaning practices. And finally, we will continue to deliver vital community outreach services to kids and families whose lives have been disrupted by this pandemic. When our schools closed for the remainder of the year, we partnered with Metro Nashville Public Schools to activate the kitchen at Camp Widgiewagon to prepare and package more than 2,000 meals a day for distribution at 4 grab-and-go sites. We're excited to share today that we will be extending that partnership and will continue delivering meals throughout the summer at these 4 locations: Camp Widgiewagon, Paragon Mills Elementary, Donaldson Middle School, and Glengarry Elementary. And since the closure of schools, we've been able to deliver vital outreach programming virtually, reaching more than 400 MNPS students through literacy tutoring, academic and social support, college and career counseling. And this is after the facility housing those outreach staff was destroyed by the March 3rd tornado. While it certainly has not been a typical spring for our YMCA or our community, we continue to be inspired by the support of our members and donors, encouraged by the resiliency of the kids and the families we serve, and grateful for the leadership of the individuals in this room as we all work together to get through this and emerge stronger on the other side. Thank you.
Thank you, Ms. Fain. Let's begin today's Q&A session with Stephen Elliott at the Nashville Scene and Nashville Post.
Thank you. Mayor Cooper, could you give us an update on the federal funds from the CARES Act and how you're looking at spending them?
Thanks, Stephen. Mayor Cooper.
Thank you, Stephen. The state also, I think, is seeking clarification from the federal government about how they can exactly be used. The state has billions from the CARES Act, and Nashville directly has about $122 million, some of which, of course, should be reserved, in my feeling, in case there is a second outbreak. And the prudent thing would be to adequately prepare for that potential, unfortunate possibility. But in the meantime, we do have several pressing needs to be accomplished, both with the state help and on our own. We have to get school restarted. That's going to require distance learning and the implementation of successful distance learning. We're going to have continue to have robust testing. Making the disease visible is going to be the key to suppressing future outbreaks quickly, which is going to be the key to getting back. And we need an economic restart. We need to get people back to work, ideally incented to get back to work. And then finally, of course, we have to make sure we're doing as good a job as possible with safety net spending. This has been so hard on so many people, and we have to do what we can to alleviate some of that stress. Now, I am hopeful that the state will take the lead, and particularly in testing and in distance learning, but we don't know. And the legislature is coming back into session shortly. I think they're going to be providing clear direction when they do on the use of the billions that this state has. And our money, which is much less, is going to have to be used in a supplementary and complementary way to getting these strategic objectives done. So to review, school start, economic restart, testing in order to deal with future outbreaks, keep a reserve so that we know that we can deal with future outbreaks. These are all going to be priorities with the CARES Act money. And then on a daily basis, I think there's change in the rules governing CARES. Of course, we're going to closely monitor all of that. And then there's the potential of supplementary bills being passed along with the CARES Act. So it's one of these situations that I think it's on a week-by-week basis, really what we know we can do, and we're going to make the best decisions with the best information available at that time. Thank you.
Nancy Amons with WSMV. Nancy, you're on the air.
Hi, thank you for taking questions, and congratulations on the good numbers. I'm sure a whole lot of people in Nashville will be very excited to hear about phase 2 coming open. I'd like to explore the rules for the live music, specifically the 2 musicians on stage. Will there be any flexibility, for example, if you have a larger stage, maybe like the Wild Horse? Can you talk about how this 2-musician rule came about? And what about just having musicians stand 6 feet apart if it's a larger stage? Can you tell me more about who guided you on this particular advice about 2 musicians? Thank you.
Thank you, Nancy. Dr. Jungir.
Thank you, Nancy. I'll tell you, there were many people in the music business that worked with the mayor's office that actually gave guidance around the two individuals on stage. The 15 feet rule came in partnership with what the state is doing. Now, with that all said, just as we've demonstrated with how we've entered phase 2, we're up to learning, right? I mean, let's try this way. We want to try to minimize the spread of this disease. So let's try it this way. And as we move along, if new best practices present or there's ways that we can make this better, we're not dogmatic about any of this. I hope we've demonstrated that from the beginning. We've put out a roadmap and we've made changes now, as you've seen. Some maybe a little less strict and some more strict. And I want to highlight, we're now at 25 people in public gatherings. Before we had projected 50 people, because when we wrote this a month ago, things have changed. So same thing with music. Right now, that our best practices come from the music industry who've been advising us, and the 15 feet also same thing as well as with the state. So thank you.
Peter White at the Tribune. Peter, you're on the air.
Hi, I have a question for Dr. Jahangir, or maybe the mayor. Dr. Jahangir, if this is out of your bailiwick, please let the mayor answer. Can you hear me?
Yes, we can hear you.
My question is, are there any plans or is there any construction going on to create a facility for COVID-19 patients in Nashville? Thank you.
Mayor Cooper.
Thank you for your excellent question, Peter. In the middle of the pandemic, with uncertain funding, it's always hard to make plans. But Nashville needs to embrace its safety net responsibilities, come up with a good plan for how we deal with our unsheltered population, get us through the current crisis as safely as we can. On the other side of it, the fairgrounds is going to need to go back to being the fairgrounds, and we're going to need to provide an excellent path for our unsheltered. Now, where the money is from that is going to depend on a lot of federal rules coming out. It's going to require what the state is going to be using with its money and with us. So Unfortunately, we don't have concrete answers to that today, but are we going to embrace our safety net responsibilities as a city? Yes, yes, we are.
Julia Palazzo, WKRN. Julia?
Good morning. Thank you. Just a follow-up on the musician question. I know you kind of mentioned the rules a little bit, but how long do you plan on keeping that? Just for, you know, some of the people that perform with multiple musicians, that's going to leave some people and some bands out of work for a while. And then Dr. Jahangir, the mobile testing unit you mentioned a few weeks ago, I believe that was going to go through Meharry Medical College. Has that been deployed yet? Thank you.
Thank you. Dr. Jahangir?
So we'll learn as we go along regarding the two. I mean, there's some great duets of Kenny and Dolly, let's say. You know, maybe we can hit some great duets going. But in all sincerity, let's just see how we learn with time, and I don't want to give a set date. Regarding the mobile unit, yes, that has come together. I believe their first deployment may be a strong word, but the first time they'll go out maybe I think as early as this weekend in our jails. And because that's an area that we've been wanting to get tested, and we will. So I believe it's either this week or next week, and I apologize, I don't remember the exact date, but I think it may be this weekend. So yes to that second question as well. Thank you.
Harriet Wallace at Fox 17. Harriet?
Hi, good morning, everybody. I've got a few questions. The first is I wanted to check in on the MDHA testing. I know that the state is providing that, but from our local health standpoint, what will be the enforcement, quarantine enforcement of those who have tested positive? We've seen what happened at the fairgrounds where they were required by law, apparently, to remain in that area. Will that be the same approach for MDHA, and what is the quarantine plan for them? My second question, this one is for Mayor Cooper. I know that there's been a lot of criticism of some shopping venues that are open, several places like that, but then there's some venues that say, you know, we have less contact, but we can't open. So I just wanted you to speak to those who feel like they're being unfairly left closed while others are allowed to reopen. And then my last question, to the COVID-19 money, I know you put together a task force, Mayor Cooper. When can we expect that money to begin being dispersed? When will that money reach people's hands? Thank you so much.
Dr. Caldwell?
Good morning. Fortunately, everyone at MDHA does have their own home, so they will be able to isolate and quarantine there just like anybody else that has a home. We'll be doing contact tracing specifically with them as we would do with anyone else, and we'd be extra cautious to make sure that the common areas are as clean as possible and that frequently touched surfaces are taken care of. But most importantly, they will be treated as anyone else. Thank you.
Thank you, Harriet. To your two of your questions. Differences, inconsistencies, we want to hear about that. Any venue or establishment that feels that we're not being consistent or just, get online, call our health department. We want to be fair. You have a very complicated economy, and we're not trying to impose random rules for the sake of imposing rules. There is a public health reason for the rules, and ultimately it is trying to create less density, less clustering, except in affinity groups. In your family, if you can go to 25 in an affinity group, but not across affinity groups if possible. So I'll tell you what I tell the health department every day, which is to be just, be consistent, and work the problem. Let everybody present the problem that they have in their restart and consult with us in working the problem with the end in mind. And the end in mind is to have fewer transmission potentials as we reopen our economy. Now, for the COVID-19 money, and it's when are we dispersing it? I'm going to be less clear about that than to cite the federal rule that it must all be dispersed by December the 30th. But we don't know the paths of the disease, and so I do hope that we reserve our own city kind of special appropriation money into the fall to make sure that we have those resources should there be a second outbreak. But in the meantime, we are going ahead, and with the support of the council, and I think there's going to be a council process on that, we would like to commit to some things, such as hazard pay to our public safety officers. That's something that would be dispersed in December, but we are going ahead and trying to make a commitment on that as soon as possible. And then I think in terms of disbursement of COVID-19 money, what the state decides to do with its money will deeply inform what we must do with ours, consistent with an economic restart, getting schools back in session, having distance learning be effective for our children. They may be back in person, but frankly, the distance learning is something we needed to do anyway. The digital divide is something that we've needed to address as a community anyway going forward. Then making sure that there is the testing capability to shrink any outbreak that may happen in the future becomes extremely important with the COVID-19 money. But in all cases, we cannot create, this is temporary money, and we have to be careful. It is not able to replace operating expenses, but it is here to create a more responsive community in the post-COVID world. And embracing our social safety net responsibilities is also fundamental to what we need to be doing with it. Thank you.
Those are all the media questions this morning. I'd like to thank Dr. James Hildreth and Ms. Jessica Fain for participating in today's press briefing. The next scheduled Metro COVID-19 press briefing will air on Tuesday morning, May 26th at 9:30 a.m. Regular press updates, including data from the Metro Public Health Department, will be emailed daily to local.
All right, everybody, you're listening there to the Metro Davidson County Coronavirus Task Force briefing here today, and we had good news straight off the bat from Mayor John Cooper, who said this Monday, May 25th, which is Memorial Day, he says that will mark the move into phase 2 of reopening for Nashville. This means that all the public health metrics that they've been monitoring here, he said, have shown satisfactory results. So quickly here and briefly, I'm going to run through what phase 2 means for Nashville. It means restaurants and retail businesses can extend their openings from the 50% that they're opening at now to 75% of their full capacity. Again, he said that's beginning Monday, May 25th. Also, live music next week can return to Music City in a phased-in format, meaning no more than 25 people in one enclosed space listening to that music at one time. He talked about amusement, attractions, salons, close contact businesses can all reopen at 50% capacity beginning next week. And he did touch on this again. All employees in Davidson County businesses of any kind are still required to wear masks to protect themselves and protect the customers. We're going to have much more on what came out of this meeting today coming up on News 4 at noon. Thanks so much for watching.
We now return to regular programming. Get more updates at WSMV.com and on the WSMV app.